Hello, my name is Yamillie Ortiz from Hosanna Medical Center. Welcome to BeHealthyTV on Spectrum TV. Today we are going to be talking about menopause in women and andropause in male patients. We both, female and male patients, after 30 years old, we start with a decrease in the hormones levels. Male patients, they start after 30 years old having a decrease in testosterone levels. And women, we start having after 30 years old also a decrease in testosterone levels, estrogen, and progesterone. What are the symptoms that we are going to have regarding to this hormone imbalance? First, we are going to have, for example, lack of energy and fatigue during the day. Also, I have many patients that they come to my office telling me that they cannot sleep very well at night. They have insomnia. They also, maybe they can start taking medicines to help them to sleep, like Ambien. And when we fix all the hormone imbalance, the patient is able to sleep better without over-medication. Another symptom that we start having is, for example, also memory loss. We start being like mental fogging and forgetting everything, and this also is a consequence of the hormone imbalance. Another thing that we start having is very difficult to lose weight. It's very hard for us to lose weight even we are eating almost the same, and it's also because of that. In women, because we are very hormonal, also we start having mood swings. Sometimes we can feel like anxious or depressed or sad, maybe crying because without reason, and also this is because of that. Another symptom that I have very frequent in my office is when the patients start having like joint pain. I have even patients with rheumatoid arthritis that when I do the hormone replacement, the joint pain is getting disappear, and that's really, really good. In women, I have women also that they have vaginal dryness and low libido. This is very frequent. And also in male, they have, of course, the same lack of energy, and they have problems, like for example, erectile dysfunction. They don't have the same performance in the sexual activity, and this can affect the relationship with the wife and everything. What we can do to fix that problem? So in Hosanna Medical Center, we specialize in hormone replacement with bioidentical hormone. It's called pellets. The pellets is a subdermal implant. You have many options. You can replace the hormones, for example, with creams and injections, but the creams and injections, I don't recommend it, because in order you to put the hormone in the cream and injection, you have to add a lot of preservative, and this is not good for us. Also, testosterone injectable. The male patients that do hormone replacement with testosterone, they have to get the injection maybe weekly or every 2 weeks. And the testosterone injections, they are very associated with cancer. The advantage of having the subdermal implant is that the pellets, they have bioidentical hormone, is preservative free, and you don't have to do it every day or every week. It's just a subdermal implant that you're gonna do like a minor surgery. I do a minor surgery. We put the pellet that is a very small piece. It's like a pill, looking like maybe a Tic Tac. And when I put the pellet in the right upper quadrant of the gluteal area, the pellet is gonna be reabsorbed every single day, the same amount, until it disappears. In male patients, that is great because they have to do this only maybe twice per year, every 6 months. And in women, last 5 months. Depends on the metabolism of the patient. If the patient smokes, the pellet gets burned faster. So this is regarding to this. And how I know how much testosterone or how much estrogen or how much progesterone the patient needs is all with blood work. The patient comes to my office and I do the order for the hormone levels. And of course, I have to take the medical history of the patient I have to take the weight. I have to do a questionnaire so I can know exactly the medical history, medical conditions. And when I have everything of that, then I can do the calculation and I can put the pellet in the patient as the patient need. After I do the procedure, we check the hormone levels again after 6 weeks so we can be sure that the patient is having the goal of the hormone that they are supposed to have. What are the benefits that you're gonna have after the hormone replacement? You're gonna feel younger, you're gonna feel with more energy. If you have any kind of condition of arthritis, back pain, the pain is gonna be away. You're gonna be with a better libido, and also the male patients, they are gonna be with better performance in the sexual activity. You're gonna be also with better ability to lose weight, because this procedure increases the muscle mass and will give you a lot of energy. So you can go to the gym, you can do everything in your house, and it's something that it will help with your family and also in your job. You will feel younger again. So this is something that I strongly recommend to everybody, because it will avoid that you have also another medical conditions. For example, low testosterone levels, they are highly associated with osteoporosis, and it's also associated with dementia or Alzheimer. Also, I would like to talk to you about high blood pressure or hypertension. I have many patients that they are having the blood pressure above normal range. The normal range in a blood pressure is 120/80. It's very important that in your house you have to try to have always the blood pressure machine just in case you need it. What are the symptoms that sometimes a patient can have when they are having high blood pressure? For example, headache or migraines. I have many patients that they come to my office, oh, I have this migraine attack every single day, or I have headaches and also or migraine attacks. And then I realized that the headaches and migraine attacks is not like that, it's high blood pressure. Also, I have patients that sometimes they cannot sleep very good at night. This also can be, if you cannot sleep well at night, please check your blood pressure. The best way so you can check your blood pressure is in your left arm, and I recommend the blood pressure machine that is in the arm, not in the wrist. Why? Because in the arm is closer to the heart. So if you're gonna get a blood pressure machine, try to get it with the bracelet in the arm. What we can do in order to avoid to have high blood pressure, or what you can do if you are having like borderline high blood pressure and you don't want to take medications, because nobody wants to take medication if it is not necessary. You can do 3 things. Number 1, try to keep a very low sodium diet. Avoid, for example, Chinese food, soy sauce, all this funny food that is a lot of with a lot of sodium, and also canned food. Okay, like hot dogs, hamburger, fast food. Keep away from all that food, and also this will help you a lot to keep your blood pressure under normal range. Number 2, cardiovascular exercise, for example, elliptical or walking or bicycle. When you do that, the study shows that all the cardiovascular exercise can decrease the blood pressure even 20%. And number 3, if you lose weight, your blood pressure is gonna be much better. I have patients that they are even taking 2 or 3 pills for blood pressure, and they are with obesity, obesity number 2 or number 3. And when I talk to the patient, it's very important for you to lose weight, and they lose, for example, 12 pounds or 20, I have to take off some of the medicines, tapering down, and sometimes I say to the patient, you don't need the medication for high blood pressure anymore, because they lose weight. And if you lose weight and you keep like these 3 things that I already tell you, cardiovascular, very low sodium diet, and trying to lose weight, you're gonna have a better blood pressure, okay? Also, another disease that I see very frequent in my office is diabetes. Hispanic population is number one patients in diabetic disease because we love starch, we love rice, we love sweets. For example, the Cuban bread or pan criollo in Puerto Rico, pasta, rice, of course, all pastry and all starch, sodas, all that kind of meals will increase your glucose levels. And what you can do also to avoid that, but so it will be for you to do a cardiovascular exercise. Try to avoid skipping meals. When the patients skip meals, this is not good, and this is a risk factor for you to get also diabetic. Why? How you can know if you're a diabetic patient or not? With a blood test. We do in the office, of course. For you to get the blood test, it will be in fasting. How do you know if you are a diabetic patient? Of course, the patient with diabetes have some symptoms, like for example, they are always thirsty. They are going to the bathroom to do urine very frequently. They feel tired. Sometimes they lose weight. This is some of the symptoms that they used to have. For the blood work, you have to be under 99 milligrams. This is the normal range, 99, normal patient without diabetic. Above this, it will be diabetic patient. And also we have to do A1C. The A1C is the gold standard test for diabetic patient. It's supposed to be below 5.8. If you are 5.8 or above, this is considered a pre-diabetic patient. If you want to know more information about all this, and if you are interested in hormone replacement therapy with pellets, or you have any conditions, you are more than welcome to come to my office. We are located in Hosanna Medical Center, 16215 State Road 50. This is in Claremont, Florida. The telephone number is 407-395-2348. We work Monday through Friday, 9 a.m. to 5 p.m. We take walk-in and also patients we schedule. We take all the insurance, but if you don't have insurance, you are also more than welcome to come. We have a special offer of only $99, and we also speak Espanol, and we also speak English. So I will be more than happy to take care of you. Thank you very much for watching us, and this is BeHealthyTV.
Hey everybody, this is Tim Taylor, president of CareBeyond. Now, if you've got anything that hurts, if you've got some discomfort, if you have a hard time sleeping at night, you're stressed out, low energy, or want to improve your sex drive, stay tuned, because we've got some revolutionary information and potential solutions for you. CareBeyond coming up soon.
Hi, I'm Danny Ramos, and welcome back to MedTV. And I'm here with Tim Taylor, who is the president and CEO of one of the best and new companies introducing CBD into the marketplace. Tim, tell us of everything that's going on in the marketplace about CBD. Everybody's talking about it. Everybody wants it. Everybody thinks it's the new miracle drug, but it's not a drug, by the way. But anyway, tell us about it.
Well, Danny, thanks for having me on the show. I appreciate it. CBD, in about 30 years of nutrition, I haven't ever seen anything like it. It is just over the top of all the nutritional supplements and things that are out there. I've just never ever seen anything close. We've had people's lives are being changed so dramatically that we have doctors and organizations that are contacting us. We are in the healthcare industry, and even our doctors are just blown away by some of the clinical responses that are seen in the area of CBD, just in general.
Is CBD, the product that you're selling is over the counter? There's no special, you don't have to go to a doctor and get a prescription like with medical marijuana, it's over the counter?
No, everything that we have is definitely over the counter. And since the Farm Bill of 2019 came through, it's available in all 50 states now. Now, one of the things that's different about our company, we have a company called CareBeyond. And what CareBeyond is all about is it's going beyond traditional mainstream medicine. It's going beyond just the treatment of symptoms that most doctors do. I mean, most doctors that we go to in the medical space today will go out and prescribe. They work really hard to do a great job to try to help people, but what they're spending their time doing is prescribing medications that in most cases are simply treating the system, and treating the symptoms. And in many cases, they're actually exacerbating the situation by creating more side effects. We've all seen the TV commercials and things that go on and talk about, hey, it may solve this, but by the way, it causes death, anxiety, and all the other things that go along with it.
You see them on the air all the time.
Right.
It scares the hell out of you when you get, oh, this thing is great and it's going to solve this problem, but you may die of it, you may convulse, you may faint, there's so many negative aspects to it.
And I'm not knocking doctors. Doctors do a great job. Where we're at is focused more on functional wellness, Danny. So we're taking a product where the idea is to address the root cause. Most root causes of many diseases and illnesses are brought about simply by a nutritional deficiency, something that's lacking in their system. So what we've taken is not only products with just CBD. CBD is fantastic, but we've also learned over many years that lots of great natural supplements can do wonders for people. So it's taking the combination of those products, those supplements, and creating what we call functional supplements that are directly targeting particular areas of health. For example, if somebody has anxiety or stress, I know a lot of people that are watching here today know what I'm talking about. Can't sleep at night, you're tossing, turning, just stressed out. We've got something that targets that. It's targeting that specific item. We've got people with pain or discomfort or something that hurts. We've got something that's targeting that. Likewise, low energy, low sex drive, poor stamina. You're just more exhausted at the end of the day than, you're still ready to things to do, but you can't do anymore. We've got something targeting that. And so many other things as well.
Yeah. One of the things that everybody's concerned about, there's a massive addiction problem going on in the United States. Just massive. I mean, the president talks about it almost every week. There are states that have increased their addiction problem. The products, is there any addiction situation to your line?
You're talking about the opioid crisis.
The opioid crisis, yes.
The opioid crisis is brought about in two different forms. One is just the illicit drugs that are coming in across the border and so forth that are pouring in and people are taking advantage of it, but then also the ones that are actually prescribed. And what it comes down to is when your body gets to the stage of, with these types of medications, it starts off and then you build up a tolerance to it, and as you start increasing the dosage in order to keep that pain down or whatever your target is, your body just can't handle it. It becomes toxic and you end up shutting down. So we see athletes, for example, in the prime of their life that had a simple knee injury or something that have got so far along that their liver just shuts down. They can't deal with it and they die. And it's an opioid crisis. More people are dying from opioids than virtually anything else in the country right now.
So your product, because it's over the counter, is completely void of that?
That's right. It's completely void of it. There has never been, as far as I'm aware, or any research that us or any of our doctors have ever studied, anybody that's ever had an adverse or overdose from CBD, or for that matter, cannabis. Now, many people in cannabis, on the THC side of it, where people use products to get high, sometimes they're going to crash a car or do something like that, but it's not something where your system ever shuts down. CBD on this other side has no toxicity whatsoever.
So it has no TH?
No, it has no THC. Let's take a second and see a quick overview of what CareBeyond does in some of our products.
All right, sounds good.
Welcome to CareBeyond, the health practitioner's choice for hemp-derived CBD-based health products. People everywhere are talking about something called CBD. Have you heard about it? You probably will, and in a big way. Did you know that by 2020, the market for cannabidiol, or CBD, is projected to grow by more than 700% and produce billions of dollars in sales just in the United States alone? I mean, can you even imagine what it's going to be worldwide? That's right, CBD is becoming a big deal in today's world. And the reason why is that this amazing plant extract has been found to have some potentially major health benefits. So much so that even well-known celebrity doctors like Dr. Sanjay Gupta and Dr. Amritaz have recently done major exposés on it. And we believe that once you look into it for yourself, your whole perspective on what's even possible for a healthy lifestyle may change forever. So what is CareBeyond all about? Well, simply put, it's about feeling good. It's about living the quality of life that you really want to live, and it's about helping others to do the same. CareBeyond has deep roots in healthcare, with genesis from hospice care to medical clinics and senior care, where we work with hundreds of health professionals. These health professionals do their utmost every day to try to bring relief to the suffering people and to deal with health challenges where real solutions are not always found. See, it was here where the company was born, with natural products scientifically designed for real people with real issues to go beyond the basic norms of healthcare to provide them with what we call CareBeyond. Cannabidiol, or CBD as it's commonly referred to, is perhaps the most potent source of phytocannabinoids known today. Our clinically developed formulas start off with top quality CBD extracted from USA-grown natural hemp that's scientifically refined for purity and efficacy. It has zero measurable tetrahydrocannabidiol, or THC as it's commonly known, which is the psychoactive part of regular cannabis, and it's therefore completely non-psychoactive and non-intoxicating. Each of CareBeyond's CBD-based products are custom blended with other proven natural supplements to create totally unique formulas that are specifically dialed in to support target areas of your body and mind. Manufacturing is done in a world-class CGMP pharmaceutical-grade facility, and each product is subsequently independently lab certified for quality. The result is a line of super high-quality, totally unique products that we believe will perform well beyond your expectations. It is indeed CareBeyond.
Boy, that clip was really, really informative. So your products are preventative as well as immediately addressing an issue.
That's right. What our products are designed to do, at least on the CBD level, is to address an endocannabinoid deficiency. You see, your body is actually the endocannabinoid system most doctors weren't really aware of when they went through medical school. It's only been over the last 2 or 3 decades that a lot of research has been done in that particular area. And what they found is as your endocannabinoid system gets out of balance simply by a nutrient deficiency that most of us have, most of our other systems, your cardiovascular system, your renal system, you name it, all of the other 10 major body systems are affected in one way or the other. So as you bring your endocannabinoid system back into balance, your body has a chance to heal itself again. So instead of addressing the symptoms, as in many doctors do, yes, there's infection fighting things that are out there, and surgery are the only real curative medicines that are out there. But this is something that is indeed preventative by simply enabling your body to be able to correct its own issues.
Mm-hmm. We live in a society of high pressure, fast food. And fast food, you and I know, you drive up to the window, and no matter what, that food is being made to be cost efficient.
Right.
So it's a low price food, and you know that the food is not necessarily, well, it's not as healthy as it should be. So how do you integrate your product into that concept of the fast food society?
Well, you know, that's what it's all about, is just fast food is one of the things that have gotten us where we are today, where diseases are so rampant, where illnesses are so high, where autism has gone off the charts. You know, it's from the fast food and sedentary lifestyle that we have. We're spending our time behind computers and just eating junk. You know, as good as many of those foods taste, the additives that they have to put into them in order to keep them shelf ready for a period of time are just toxic.
There's a lot of controversy about what goes into those foods.
Right.
So you need that additional balancing.
Well, this one thing I learned is you got to supplement. You need to do something. And of all the supplements that I've found, using our particular products, the CareBeyond products, will help you to not only address your endocannabinoid system, but our functional, formulas that we're using are also addressing the particular nutrient deficiency.
So how many products do you actually have?
We've got 6.
6. And again, I know you mentioned it a little bit, but tell me again, what are those targets for those products? Because I know you have a patch, you know, and that you use for specific pain areas, right? Right.
Well, for example, the patch is, CBD at large is very common. You're starting to see it. It's becoming commoditized. What we've done is we've developed, our doctors have developed a CBD nano patch where it takes the CBD particles and brings them down to the size of less than 100 billionths of a meter, excuse me. That's nano size. So consider a bowl of marbles. If you poured sand on top of it, it just flows right through. So it is with this patch as you put it on your
So
skin.
the bowl of marbles is your skin.
Right.
So when you pour the sand in, it goes through the pores.
Yeah, it permeates virtually like an X-ray. So we have a much more efficient, you stick this patch, you forget it, you don't have to spill it, you don't have to taste it or anything.
And the
else.
patch is used for what purpose?
The patch is basically to stabilize in your endocannabinoid system. So it's introducing CBD directly into your system, right at the tissue level, wherever you've got your primary issue of concern. And then it permeates through the rest of your body and lasts for about a 24-hour period.
Okay, and then you also have Vitality product. You have different. Tell us about the other four.
Let's start off with the top. We've got a product that's called Immunity. If you have autoimmune challenges, if you get colds, flus, allergies, if you're just sick more often than you should, the Immunity product uses CBD compounded with super antioxidants to address that at the cellular level. So you're bringing your body back up. So your body has a fighting chance to be able to protect itself. We've got a product that's called Theramel, which uses CBD, but it's compounded with other super anti-inflammatories. CBD on its own is one of the most potent and effective natural anti-inflammatories known on the planet, but when you compound it with blueberry and some other types of natural antioxidants that are included in there, the benefit for addressing day-to-day pain and aches and joints and inflammation is off the charts. Then we've got another product, Danny, that's called Tranquility. And Tranquility is basically using CBD, but it's targeting your neural pathways so that you're able to relax and chill without being dulled down or degraded in your performance and your mental capacity.
And without drugs.
Right. You're just feeling relaxed. It's happy pills. It's just chill.
Yeah,
and
that sounds really good.
We have people that can just sleep all night that have had challenges for years being able to break through with insomnia and other types of things. Again, these aren't intended to diagnose or treat anything. It's just by balancing your endocannabinoid system, everything works better.
So how does someone get your product?
Well, you can basically go on, as you look down on the bottom of our screen, there's a call out right there that you can see. And at the bottom of the screen, if you can go and you can even actually try them for free. We know that these products work. Our hundreds of doctors that work with us are very aware of their effectiveness. We've got documentaries in production and how effective these products are. But the key to it is just try them. All you people can, out in the audience, if you're looking at this out here, you can try these products. You can use them, take it, just follow the instructions on it. Nobody's going to hound you to reorder, but it's going to change your life.
That sounds really terrific. We're just run out of time. We will be running segments every week, and also we're going to be doing email blasts, so you can click on a link on the email that we're going to send out, and you can see the videos, and that'll take you to the product lines, so you can become more educated on what this product line can do for you. So you got the website at the bottom of the screen, or you can call the number. And if you want to add yourself to the email list, just also call the number, and we'll be doing these shows every single week so that you can become more informed of the new innovations that CareBeyond is bringing to the marketplace. We'll see you next week.
CareBeyond products are of the highest quality.
It's really been life-changing. My anxiety levels are back down to normal.
Yo tomo Tranquility, Theramil, uso el parche y me encanta.
I love being able to share these products with my fitness clients. They love the product.
I've been taking the product for a little over 2.5 months now. This is the best thing I have ever seen.
I love it! I'm really excited about these products and what they have now and what they're going to have to come in the future.
What I like is that they contain what they say they contain, 100%.
And then to have it as a patch. No mess, no muss, you stick it and forget it.
I work as a nurse and I've been using Vitality for 6 weeks as a pre-workout. I've noticed the changes in the endurance, my workout, I've been able to push myself.
I was kind of skeptic about it. I gave my wife that patch. That patch worked excellent. This is for real. This is the real deal.
I love the products.